back to our pharmacology series. In today's video, we are talking about pharmacodynamics. This simply means how the drugs act on the body. By the end of this video, you will understand the drug receptor interaction, dose response, potency, efficacy, and many more, all in simple language. So, pharmacodynamics or PD explains how a drug produces its effects, how it binds, where it acts, how strong it is, and what the response is produced in the body. If the pharmacokinetics is the drug's journey, then the pharmacodynamics is the drug's action. First, we will discuss about drug receptor interaction. The drugs work by binding to receptor like a key fitting into the lock. Most drugs work by binding to a receptor. So receptors are like lock and drugs are like keys. When the drug attaches to the receptor, it starts a response inside the cell. So we will understand that the receptor is working like a lock, whereas the drugs are working like a key. Then we will discuss that there are three types of drug actions. First is agonist, second is antagonist, and third is partial agonist. So what do you mean by agonist? The agonist can activate the receptor, which can produce the full response, and it can be turned on, cause the biological response. Examples are the salbutamol, which can activate in B2 receptor, which can open the airway. Second one is antagonist. It can block the receptor. The block the receptor means prevent a response. It can turn it off, prevent other drugs or chemicals from binding. So we have to take some example. The beta blocker can lead to block the beta 1 receptor, which can slow the heart rate. The third one is partial agonist. Partial agonist produce a weaker response. It can turn the receptor on halfway, give a weak controlled response, which can the example is buprenorphine. It is a partial opioid agonist. One is dose response relationship. This explains how the effect changes when the dose changes. There are two important ideas. First one is potency and second one is efficacy. Potency means how much dose is needed. If there is a less dose, which can be the more potent, and whereas the efficacy means how big is the maximum effect. It means how much the drug is needed to produce an effect. It is potency. So we will take some example like morphine is more potent than codeine. And second one is efficacy, the maximum effect a drug can achieve. So we have to take some example that paracetamol relieves the mild pain but cannot achieve the strong analgesic of morphine. One is dose response curve. Low dose leads to little effect. High dose leads to stronger effect, and very high dose leads to the effect levels of which can be described as Emax. So it shows us the EC50 dose that gives the 50% of the effect, and Emax is the maximum effect of the drugs can produce. So dose can lead the effects of until the curve flattens. Until the curve flattens can help us to compare the drug based on the potency and efficacy. So third one is mechanism of action. This means how a drug produces its effect in the body. What it does at the molecular level. A drug's mechanism of action may involve receptor, enzymes, ion channels, transporter or pumps, and last one is physical or chemical action. So let's briefly discuss about them. First one is receptor. Example, morphine can bind the opioid receptor, which can lead to relieve the pain. And enzymes example is ACE inhibitor, block the ACE enzyme, which can lead to lower the blood pressure. Third one is ion channel. The examples are local anesthetics, block the sodium channels, which can be leads to the stop nerve conduction. Transporter and pumps are example are SSRI, block the serotonin reuptake, which can be leads to the more serotonin available. The last one is physical or chemical action. The examples are antacid, neutralize the stomach acid directly. Last, we will know that the drug receptor interaction can include the agonist, antagonist, and partial agonist. Then the dose response can have the potency, efficacy, EC50, and Emax. And last one, the mechanism of action, how the drug actually works, receptor, enzyme, channels, pumps, etc. If you found this helpful, hit like, subscribe, and turn the notification bell. In the next episode, we will explain that the drugs names, it means the generic versus brand name, in the simplest way with example and mnemonics. See you in episode 4.